So the world trend, the global trend is going to avoid the peak cages as much as possible and going towards the titanium. But if you have to kind of prioritize or give points, which are the cages you'll prioritize? 3D printed versus 3D printed titanium, peak, how you'll rank them for current scenario? Gibran.
Obviously not being a clinician myself, and having bias because I'm dedicating my every waking moment to commercializing advanced 3D printed titanium. That's where the literature suggests everything's headed, but I'll defer to Mike for a clinical perspective.
Well, look, I think we have to have a clinical perspective of not every one of us is going to be selling in the US, right? The biggest market in the world that pay a high price. I mean, we're spine surgeons all around the world, right, doing these things. And, the prices that are paid for medical devices in Australia and the US is completely different even from Europe, even from the subcontinent, I think the refinement of 3D printing to make a high quality product that fuses well in patients from all around the world is a huge advance, right? Because you can have local manufacturing, you're not dependent on overseas companies, overseas IP, overseas supply chains. So whilst you're seeing a glimpse into the last 5 years of Gibran's manic life, it's a huge process. It can be done. That's the point. You don't need to just rely on the big companies in the US. And sometimes you're at their whim. I mean, we had Johnson & Johnson just pull Spine out of Australia. They just left.